This is the Emergency Medical Minute, sponsored by Mile High Ambulance.
I have to stop pulling my medical minutes from my own personal experience, but today we're going to do that again. My house is going through a bout of gastroenteritis right now, unfortunately. I will attempt not to touch anything today. So we'll talk about peds gastroenteritis specifically and kind of some of the ways that we have to rehydrate those patients. We're definitely seeing a lot of it this year. One thing before you diagnose someone with gastroenteritis, you kind of want to make sure that they have the vomiting and the diarrhea. Vomiting alone can be a bunch of things, so it's nice to have them have both components. It makes you feel a little more reassured that that's actually what's going on. Typical bout of gastroenteritis lasts 1 to 3 days, but can last up to 14 days depending on the etiology. Some of these viruses can just take longer to resolve, especially with the diarrhea component. When they come in, there's kind of 2 ways to rehydrate them. We can rehydrate them orally, or we can do it via IV. IV is probably a little bit more than most of these kids need, and so we like to do it orally if possible. The first thing you have to do is stop the vomiting, and so we tend to do that with ODT Zofran. We have a simple cutoff here at Swedish, so if the kid is less than 16 kilograms, we just give them half of an ODT, which is 2 milligrams, and then if they're over 16 kilograms, we give them the whole thing. They dissolve pretty well. Sometimes if they're just nauseous, they're not vomiting, you can do it with a little bit of something kind of mushy like applesauce. Most of the time, I think it's easiest just to kind of get the pill in there. They'll kind of take down what they can. We can't stop the diarrhea, unfortunately. That tends to be the most lingering symptom, but it is sort of also the body's way of just like getting the demons out. So we can't stop that, unfortunately. That kind of has to just run its course. So we've stopped the vomiting. Now we're going to try for some oral rehydration. And I like this method because it's a little bit more streamlined than what we typically tell parents. You know, we like to give the med, we give it a little bit to simmer, so 15-20 minutes to simmer, and then we try and rehydrate kids. Most of the time we're just saying, try something, start slow, whatever the kid will take. But one way to do it that's a little bit more organized is if the kid is less than 10 kilograms, so anything less than 10 kilograms, you're going to give them 5 mLs of fluid, and you're going to do that for about 20 minutes per minute, 5 mLs of fluid per minute for about 20 minutes. If they keep that down, then you can up it, you can double it. If they're over, or if they're 10 kilograms or over, you're going to do 10 milliliters of fluid. You just double that after 20 minutes. If it works, great. You're going to double it and do it one more time, and then you can send the kid home. If it doesn't work, you get 1 fail. So say you do your 5 milliliters per minute for 20 minutes. It doesn't take. You're going to give them another dose of Zofran. You're going to try one more time. If they fail it a second time, then we're stuck with an IV. And again, most of these kids aren't that volume down. It's probably like 5 to 10%. So they're not super dehydrated to begin with. We're trying to avoid sticking them if we can, but it's a little bit more of an organized way to do this oral rehydration. What fluid do you use? Most of the time here we use Pedialyte, which is handy because it's just close by and we have it. There's something called Rehydrate, which is what the WHO uses in other countries. I don't think we tend to stock that. Infalyte is something you can give to younger kids, but it's kind of whatever you have on hand is really the best fluid to use. And then most of the time, sending kids home with Zofran, you can usually do it for a couple of days. Like I said, that tends to be the symptom that resolves a little bit faster. And so you can send them home with a few days, a day or two of Zofran just to help them get through the kind of hump. But again, not recommending anything like Imodium or anything that's going to stop the diarrhea, because depending on the etiology, you can make the kid quite a bit worse.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.